Hi, everybody, and thank you for joining us for the Evidence Review Pilot Information webinar. We're really excited to talk about this new pilot that you might not be so excited about being part of, but we do appreciate it, and we're happy to give you lots of information that can help. My name is Dana Prushi. I am the Director of Professional Practice and Quality Assurance.
And I am Sarah Chapman-Jay. I'm Advisor for Speech Language Pathology Professional Practice and Quality Assurance. And I'll also add that I was peer assessed in the past and I've been a peer assessor. So I will add any tips along the way that may be helpful as well.
Great. So as always, it would be best to close other things that you have open on your computer now to get this program working well. If you have any problems, any technical issues, close it down and then reopen. And also, so you know, the recordings will be posted to the website on the peer assessment page. There's a little place that you can ask questions. There's an orange box with an arrow. And if you click on that, you can enter questions. We'll stop for questions during the webinar today, and then try to get back to you if we don't have time for everybody's. So let's see what we're talking about today. First, we're going to talk about how to upload the evidence and also what evidence to upload. We're getting lots of questions about that. I think that's really fair. Those are the things you need to know. What happens if there's missing or incomplete evidence? And then what's next? What happens after this whole thing is done? So we have lots of resources available for you on the website. So the way that you access that is you hover over registrants here at the top. And then if you go partway down in the middle, quality assurance program, peer assessment program. So this is information about peer assessments, but at the bottom is the evidence review guide for this pilot project. All right, so the first thing that we wanted to talk about is really to answer the question, why does CASLPO make us do peer assessments and quality assurance? So it's not a CASLPO decision, but it's legislated by the Regulated Health Professions Act. All 26 colleges do some form of peer assessment. So your chiropractor, your massage therapist, your dental hygienist, they all have to do quality assurance and something for peer assessments. The other question is, why are we adding this evidence review this year? As you know, quality assurance measures audiologists and speech language pathologists' knowledge and skills to ensure they're meeting standards of practice. And quality assurance also wants to support the registrants' improved practice by providing education and resources and help registrants improve skills to provide safe, effective, and ethical care. But we're a really small college and we're only doing peer assessments for about 2.5% of our registrants, which is not even statistically significant. So other colleges are doing 5 to 10%, although some of them do have their own problems with that. By increasing the number through this trial, the evidence review program will help to strengthen public protection. A word on peer assessors. All peer assessors have been peer assessed themselves and they know exactly what it's like to be in your shoes. They then went on to be peer assessors and they go through annual training and take on a number of peer assessments over the year. They're warm registrants who want to give back to the professions. Peer assessors and this program are not out to get anyone. The process is not punitive and it can be a very positive learning experience. You'll have less interaction with the full peer assessors than in the full peer assessments, but peer assessors will reach out to you via email if there's anything missing or insufficient evidence that you've uploaded. If they're satisfied with your evidence, you may not even hear from them, but just receive a synopsis instead. And we'll talk more about that later.
Okay, Dana, so this might be a good time. Let's actually go into the SAT and we will talk about what the peer assessors will be having a look at in terms of evidence review. So the first part really will be the practice description. And most of that is self-explanatory. You know, what's your profession, the service settings, the area of practice that you work in, do you work with support personnel? You know all those answers and the age range. I would say a very good area to add information into would be this: provide additional details of your practice. It could be that you work in more than one practice location, you know what your roles and responsibilities are. If they haven't been in sort of those above checklist boxes, fill those in, give us some more information. So I want you to see it from the peer assessor's point of view, where this is their eye into your practice life. So add any additional details that you think would be helpful for them to know. And then number 9, which is in bright red, complete only if you've been selected for peer assessment, please provide your most up-to-date contact information. Obviously your name, registration number, but the key things here are the telephone number that is best to reach you at and the email address that you use most frequently. Sometimes people put their work email, but I know when I used to be a part-time speech pathologist, obviously I only checked it on the days I was in. So think about the email address that you give as the primary contact way to reach you. With evidence review, this pilot program this year, the peer assessor will only be reaching out to you by email. So that is the crucial one. The lowest line, when would you prefer the peer assessment to take place? That actually is not so relevant. Although I suppose you could check it because, you know what, now that I'm thinking this out loud, Dana, check it because it could be that you are not available for a certain time of the year. So check that off as well. All right, let's move to professional standards. And this is your most important job now, is uploading the evidence. There are, for those of you who are clinical speech pathologists and audiologists, there are 30 indicators in total. So 1.1, and it goes all the way through to 5.2 in the last section. So what you're going to do is obviously read what the professional standard is. There is a lovely plus box that says examples of meeting the standard. You can always click on those and it actually gives you some ideas of what you could upload for examples of meeting the standard. Now, lower down, obviously you're going to check off, do you meet the standard or you need work or it's non-applicable? And then below that on the right-hand side, it says required for peer assessment. Upload evidence from patient records. So for those who are clinically done the clinical SAT, it will spell it out to you which of these indicators you need to upload evidence from a patient record. Now, Dana's showing us the guide for the clinical peer assessments, and it shows exactly what is required depending on the indicator. So even in those first 5, 1.1 to 1.5, all require evidence from a patient record. You will see, now just about for all 30, it's one piece of evidence. And for non-clinical, it's one piece of evidence. And obviously for non-clinical, it's not a patient record. So it's other types of evidence. And again, there is that plus button that you can find examples. But I do want to home in on 1.3 and 1.5. 1.3 is for audiologists only because it's about performing and documenting the controlled act of prescribing a hearing aid for a hearing impaired person, according to practice standards and the position of the college. So the audiologists who are peer assessors feel that this is a very vitally important part of your evidence. So what they would like to see is examples of evidence from at least 2 records. So you're going to take a patient record and you're going to pick 4 phases of the hearing aid prescription. You're going to provide the hearing aid assessment, the hearing aid prescription, the verification, and the validation. So that's actually 4 phases of your intervention with that patient. And we need you to do that for 2 records. So that actually would be a total of 8 pieces of evidence. So that's for audiologists if they meet the standards for 1.3. 1.5 is another one. It won't apply to everybody. It's only going to apply to all of you who are accountable for support personnel providing intervention under your direction. So for this one, 1.5, there is a requirement for 2 pieces of evidence, 2 examples showing different aspects of supervision. So it could be where you're co-signing a record signature under the CDA. It could be where you've assigned activities or where you've obtained consent for a CDA to provide services when you assign them clinical activities. So there is 2 examples for 1.5. Now, if we look at some of the others like 1.6, this isn't actually a records example that is asked for evidence. This is maybe where you've got some other type of evidence. So because it's I ensure that all materials and equipment are in proper working order and calibrated as required. For example, the audiogram, that needs to be calibrated every number of months. There should be some kind of documentation that would prove that. You could also use a photographic evidence for how materials are stored, what you have. So there are different ways of providing that evidence. Okay, so the other thing is when you're providing information from patient records, it needs to be from at least 5 records. So it doesn't have to be an entire patient record. You need to collect the evidence that is relevant to the indicator. So you're just going to select, actually here, Dana has just provided us with an example. So this is somebody who treats children and they're seeing the patient Sam. So a page of your evidence from your records would be very useful because we're also going to see the sequence of events. This would go very well with 1.2 when we talk about records in a timely, reasonable time that you make that you document. So we can see September 1st, September 9th, September 17th. But what we have in this evidence is highlighted section in the middle, September 9th, and it's about collaborating with other interprofessionals, so with the OT. So this might be a good example for 4.2, communication and collaboration with others, or 4.3. So as we say, we don't need the entire patient record, but what you submit for each of the indicators needs to be relevant evidence. Another key thing when you're providing this relevant evidence is there is a box for comments. You know why you've chosen that evidence, but give information to the peer assessor in that comments box why you've chosen it. So explain why that is relevant piece of evidence. And so you can add that information in there. All right, so I think the other question that we have about evidence is how current does it need to be? We understand some of you may have been on some type of leave in the last 1 or 2 years. So we do say, ideally, we want the evidence to be from the last 3 years. The more current it is, I think that's helpful as well, but it doesn't have to all be this year. It can be some from last year or the year before as well. Okay, I think I'll pass it over to you, Dana, to talk about how to upload the evidence, kind of the logistics of it.
Great, thank you so much. So in the evidence review guide, there's a whole section on how to upload. So snipping, if you have it on your screen, you can snip and take a shot and upload, save that, upload it. If you have a paper file or something, you can take a picture on your phone, you can take a picture and PDF it, and then upload it to your computer and upload it to the SAT. So I'm not going to go through that any further now. But some of the things we do suggest is to create a folder on your desktop. If you have it on your computer, it'll be easier to find it to do the uploading. We also think it's really great that since you have at least 5 patient records, that you would want to have it, that you want the information to be labeled appropriately. So for instance, here I have patient record 1, patient record 2, PR1 and PR2, and also what indicator it's for. Oh, I see that, here is this patient that had a hearing aid validation, but instead of having his name on here, I'm just going to take out John S and write in PR1, and this is evidence for 1.3. This is one of the 4 things that are needed twice for 1.3 that Sarah was talking about before. So once you have all of your evidence, you also want to use the comment box. So let's upload something together now. So if I have something for 4.2, again, we have examples of things that you could do. I know exactly what I want. I was thinking about this when I did my SAT. When you click on required for peer assessment, upload your evidence, this box will pop up. You can choose the file. And here I have it, handout 4.2. This is what I want to upload. So you can see it goes in here, and you can say upload files. If this is something you need help with, you can be in touch with us, or if you know any IT people where you work or friends that happen to be very good at this stuff. So again, now I want to make a comment because I know why I chose 4.2, this evidence, but the peer assessor might not. So I would say, oops, this is a handout I made for a 6-year-old child and their family who speak Vietnamese. Visuals and pictures with words in both English and Vietnamese. So some of them will be really obvious, but you want to let the peer assessor know. Please don't write a whole essay. It doesn't have to be lots and lots of information, but just a little description would be really helpful. That's something the peer assessors all say that they really appreciate. So now I have something and I would want to save this, but let's say you've saved it and now you think, you know what, I actually have something better and I want to take it down. You can add and remove evidence until March 7th. As Sarah said, it is best to have one piece of evidence for, aside from 1.3 and 1.5, to take something down. You can see there's like a little red stop sign on the left-hand side. If you click on it, you'll see, are you sure you want to delete this file? I would say okay. And of course, you also want to change the comment that you have. Another question that comes up very often is about personal health information. So it's really important to remember that the Regulated Health Professions Act supersedes PHIPAA. So that means you can upload personal health information. The SAT site is very, very secure. There's a letter that we have in the resources you can give to your employers. There's also one we have about how the company Skillshare works and the SAT and why it's secure. It's very IT jargon. I'm happy to share this with anyone who needs it. So you can upload this personal health information. We do frequently hear from some workplaces that they have concerns about uploading personal health information. And so if you or your employers have concerns, they can call us. So while we say there's absolutely no harm in sharing this information, if you prefer to redact it, that's absolutely fine too. Some people, if they're using digital, you know, if the records are electronic, they might just make a big black mark on top of the person's name and date of birth and personal information. Other times we've seen when people have paper files, they'll scratch it out so we can't see. One thing someone did last year that was really nice was they blacked everything out except for the last 2 letters of their name or for some of the birth dates so that we didn't have the information, but you could see that it was really from a record. Okay, so I think now might be a good time to stop and take some questions.
Excellent. I just also wanted to add that I don't think I mentioned before, or you, was when you're providing evidence, please make sure it's from patient records. We are not looking for blank forms like a blank case history form or a blank consent form, because that isn't demonstrating to us what you do as a clinician. So we need to see completed forms. That's something that's important. And then you did just mention about, yes, March 7th is the deadline, you have time. So looking at some questions, nice question here. One is, can we use the same piece of evidence for more than one standard? And absolutely, we have seen this. Like one of my examples with 1.5 is that you obtain consent for a CDA to provide some intervention. Well, that could go under 1.5, but it could also go under 3.1, which is consent for services. Ideally, because we're only asking for one piece of evidence for most of them, 25 out of 30 indicators, try and choose a different one. What you might want to do is move it yourself, like Dana showed, delete it from one and put it into the other one. So that could be an option as well.
Yeah.
Any other questions there, Dana?
The example that we showed of, I think it was Sam the Lizard's therapy, we said, okay, this is a good example of collaborating with other people, but it's also showing that records are done in a reasonable time. So while you can use it for more than one, you might choose to do something else. Also, just to mention, Sarah keeps saying one piece of evidence, one piece of evidence. We know that you want to show all of the wonderful things that you do. So to show that you're doing your records in a reasonable time, people will want to show a report that they wrote that was written within a day of the assessment, or the SOAP note for intervention, or the SOAP note that was entered 2 days late that says late note, or you know, whatever that little sentence is. But one is fine. Pick one that you think best represents you and leave it at one. That's what I would say.
Yeah. Okay. So there's another one. Where are the examples for each section posted? Maybe, Dana, we could show that on the screen again. So I know we're showing you a lot all in one go. So let's have a look at 4.2. For every single indicator, there is this drop-down menu that can tell you some ideas of examples. So for 4.2, there's actually quite a lot in there, isn't there? But there's these examples in every single indicator. So if you're trying to decide what would be your best piece of evidence, just click on these examples and they will help guide you in terms of what you know you have in your patient records and what you would select as your best piece of evidence.
Yeah. I would say that some of the examples are here for people as they do their SAT, as you all know, since you've just completed it. So uploading the guide for equitable and inclusive services or a picture of the cover, that's not actually so helpful for the peer assessor, because you will have read that or you'll read it, and that's not your information. That's something from CASLPO. So again, as Sarah said, it's better to use something that's your own, that shows what you've done. Okay, there's a question here. For hearing aid verification, are you looking for the actual completed tracings or just the documentation that we conducted it? So what we had last year, or Sarah, it looks like you're ready to go. Why don't you answer this one?
Okay, self-declare, we're both speech pathologists, but when I've talked to audiologists who are peer assessors, the documentation that reflects that you've done the verification of the hearing aid.
So I think when we were looking at evidence last year, as we were preparing for the evidence review, we saw that for 1.3, it was a picture of the audiogram or a picture of the surveys that people did. I'm sorry, I can't remember all the words right now, but it was actually, again, from patient's file, not a note saying I did this, but actually showing this is the paper of what I did.
Yeah, the audiologist peer assessors will be looking for documentation to sort of prove that you've done verification, validation. And you, as audiologists, would know best how you could reflect that. Okay, some other questions. I may have missed this. So we're to upload evidence for all the indicators, correct? Right, so yes, all the ones that are applicable. You will see either you meet the standard, you need work to meet the standard, or they're non-applicable. So I always worked in publicly funded organizations, so something like the advertising one, 4.5, was not applicable to me. So I did not need to upload evidence for that. You might, if you're not in private practice, 1.10, the financial records are not applicable to you either. You haven't ever billed patients with an invoice. Okay, and then I think this was answered, but can we use evidence from this calendar year? Yes. This year, anything current, 2022, 2021, probably the furthest going back would be 3 years.
Yes, and I think that answers another question that we have also, just about how far back things can go. Everyone's practice, while consistent, you might have some changes over the years, so you want to make sure that it's your best evidence, likely more recent than from before that. Also, if you have to write a little description about it in the comments, you want it to be something that you remember, that you know what you're talking about there.
Yeah. And certainly somebody's talking about, you know, if you're working in an acute care, I mean, you're seeing patients daily that are new and could be discharged the next couple of days. Absolutely, you can you can use your most current patients.
Okay, so let's go back to the presentation. We'll have more time for questions afterwards. Keep the questions coming, and if you have questions afterwards, you are of course welcome to email us. I think for both of us, emails are better than phone messages, but we'll do our best to get back to everybody either way. Okay, Sarah, back over to you.
All right, so this is the time that you've doing sort of the hardest work. You are deciding what evidence to upload and you're uploading it. Once that is completed, what we're doing from our end is we're training the peer assessors, and the evidence review pilot is new for them as well. So it's a slightly new process. So what we're going to do, again, what you've written in the practice description is going to be important because it helps us match you to somebody who works in the same area of practice as you, works in similar age groups, that they can communicate in the same language as you. So we do provide English and French peer assessments. So what happens is we do that matching during March, and we will send you an email and you have a chance to veto one time. So if for some reason there is some, I don't know, conflict of interest or reason that you are not selecting that peer assessor to be the one, then let us know and then we will provide you with a new name. So this is all confidential between the quality assurance team and you. And so you will let us know about that. So the next step then, actually, I mean, for a while now, you've done what you need to do. You've uploaded relevant evidence, you put in comments, you feel like you've covered your part. Then it's the chance for the peer assessor. They're going to, we link them up just to your SAT, and it's their chance to review the evidence that you have provided. And they basically will go from 1.1 all the way to 1.10, all through the 2s, 3s, 4s, 5s. They will also be making a comparison. Does your evidence meet the standard from their perspective? So they're reading your evidence, they're looking at the comments you provided, and they decide, yes, 1.1, 1.2, 1.3, 1.4, 1.5, and then suddenly, ooh, 1.6. They may feel that either there's not sufficient evidence or there's missing evidence. So especially 1.3 and 1.5, because for 1.3, that one requires 8 pieces of evidence, and the 1.5 requires 2 pieces of evidence. So let's talk a bit about what they would do next. We have something called virtual remediation. So the peer assessors, if they feel there are 1 or 2 indicators that you still need work on, they will send you an educational email. They will tell you it's 1.5 and you've only loaded 1 piece of evidence. What they'll also give you is maybe some resources that we have on the website. We do have a lot around support personnel. And also, yes, what you can do and what kind of time frame that they'd like you to upload that new evidence. They'll also CC Dana Prucci as Director of Professional Practice and Quality Assurance, so that she's also aware that they've reached out to you and that there is this sort of set time frame of what you need to do. So the reason we're doing this, and this has come from our usual peer assessments, there is some research that talks about in-the-moment learning. So it seems important that if something's identified in the moment, that would be the time to address it. So, for example, there are a number of indicators, say last year, that stood out that did need work. Some of them are here. So indicator 1.2, I maintain records in a reasonable time which accurately reflect the services provided. So you need to provide not just a piece of your record, but something that reflects that you are documenting in a timely manner, that it's appropriate for the kind of service that you're providing. Indicator 1.5, I've talked about that one already, being accountable for support personnel and proof that you supervise them. Indicator 1.10 was a new indicator last year, and so this is a new one. What stood out last year is people usually wrote down what the services were provided, what the fee was, the overall fee, and they put down the patient's name, but they didn't include the registrant's name. That was the missing piece. So it needs both of those. Some other indicators, 2.6, this is an important one. I develop and maintain a professional network for seeking feedback and sharing guidance regarding my clinical practice. And honestly, this one applies, doesn't matter how many years of experience we have. It is crucial that we stay connected to our colleagues, to our peers, to leaders in the field, to current best practice. And it keeps guiding us in how we practice clinically. So some evidence for that, reaching out to a leader in the field when maybe you're faced with some kind of new diagnosis that you've never encountered before, some new rehabilitation approach that you have no experience in. So there's many reasons why we may at any time in our career want to reach out to others. Consent is another big item, 3.1. People are really very good at obtaining consent. Are we all good at documenting consent for all intervention plans or courses of action? Documenting consent that we want to include support personnel. And indicator 3.2 is all about personal health information. Do we obtain and document consent to collect, use, retain, and disclose personal health information? So we're giving you some big pointers here. Pay attention to this slide because these are the ones that really we need to see some key evidence on. Okay.
Yeah. These were a lot of the biggies from last year's peer assessment. I did see a question come in that I thought was relevant here. Someone asked about if they can use emails as evidence. And I think that indicator 2.6, I develop and maintain a professional network. An email would be great there. Show an email that you sent to someone saying, hi, I have a patient who blah, blah, blah. What have you done in the past? I think there might be Facebook groups where people talk about patients and ask questions of each other. Those could be things that you could do if that's something you think would best support the information. Okay, so we've talked about how to upload evidence, what evidence to upload, what happens if there's something that's missing or insufficient, and what the peer assessor will do to get back to you, what happens after that. So following the evidence review, the peer assessor will write an evidence review synopsis. They can't tell you if they were successful. Please don't send them many emails asking what happened. But that is determined by the Quality Assurance Committee. So the synopsis is very, very short. It really just indicates which standards were reviewed, which are met, and which, if any, have needed further work. You're sent a copy of the synopsis and have a week to provide a response to the Quality Assurance Committee, where you send it to us and we'll send it on to the committee. The synopsis and any information that you send are anonymized. The committee does not know your name. They just get a number, your PA 162 from 2023. That's all the information that they'll have, and they will tell you how to proceed. They'll decide if they need more evidence or if you have the required knowledge, skill, and judgment based on the evidence that you've uploaded. The committee meets starting in the spring about every 6 to 8 weeks, so you might have to wait that long. And then you'll get an email letting you know the final decision of the committee, hopefully congratulating you for completing the process. One thing that should be nice to hear is that you cannot be selected for a peer assessment or evidence review if this goes forward for another 10 years because you're taking part in this pilot. It might be a shorter amount of time going forwards, but we want to acknowledge that you're taking part in this. So you have 10 years where you can breathe a nice sigh of relief and not have to worry about peer assessments or evidence review. And then you'll also get a survey from the quality assurance team. You may feel like you're doing these surveys all the time, but the feedback has been really invaluable and has informed other peer assessments. And because you're taking part in this pilot, we would love to know what you think about the evidence review process. What worked, what didn't, what you hear was better about peer assessments, what you're happy you didn't have with a peer assessment. So all of those would be really good. Please do take part in the survey afterwards. Okay, I think it is time for more questions. Oh, Sarah, you're on mute.
Wonderful. All right, let's try that again. So one of the questions is, if we switch jobs over the last 3 years, for example, school board to private practice, can we still include evidence from the previous employment areas, or does it need to be from your current employment? So that is a good question. It's evidence review, like when it's a peer assessment, we would say something that you can easily access also for the interview. So for this one, I suppose technically, if you still have access to your previous employment records, that's the part I guess I would question. You would basically be accessing records that you are still able to access. So it depends maybe how much evidence you have. What would you say, Dana?
Yeah,
I know, I'm just like, what if you've just come back to work in January?
So like as far as the rules go, absolutely, you can have evidence from any place of work, again, within the last 3 years. More recent is better. But it sort of comes down to the relationship that you have with your previous place of work. Or, can you access the files? I know there have been some people that we've spoken to in the past that have left somewhere, but when they speak to their previous employer and say, I'm going through a peer assessment and or whichever stage it is, and I need something that shows what I've done with patients, they'll let you have access. And that's something that isn't a problem. Again, because this is something from the Regulated Health Professions Act, if hospitals know that this happens, because it happens to all of the regulated health professionals that work in the hospital. So if you're no longer with the hospital, but you'd like to have access to the information, then it might be something they'd be able to help you with.
Okay, and there's a question, how might we show evidence of belonging to a special interest type group for indicator 2.6? And, Dana already said there might be an email about an invitation or minutes from special interest groups. And again, there's a sort of a second question related, can text messages or social media be used? I would say yes, that could be. I mean, you're never wanting to share personal health information, but if it's literally, I don't know, you're joining an organization or a special interest group that is for one type of clinical presentation, something like that, maybe it's something unusual, corticobasal degeneration. Yeah, whatever it's pretty open. It's just you finding a way to show that evidence. And if you feel like you have a text message or an email or something else on social media that is relevant and pertinent, that could be good evidence.
Yeah, absolutely. I think there's no hard and fast rules that you have to put in this type of thing, you have to put in that type of thing, but just think about what you feel best represents. Again, if it says patient record, please do put something in from a patient record. But if it's not necessarily from a patient record, the social media can be fine, assuming that it's appropriate and not talking about anything. You don't need to show what you're talking about outside of work, I guess. Okay, are there any more questions? I think
not seeing other questions right now.
Okay.
Again, I mean, if you want to reach out to us, we've shown you where the guides are. This recording will be posted in the peer assessment section on the website shortly. And yeah, I think we got a final email with our final slide with our email addresses.
Yes, so here it is. There is the quality assurance at CASLPO.com, which might have been where you got your lovely email back in January, or it might have been from me, and my email's there and Sarah's, so you can email either of us with questions. but also talk to people that have been peer assessed in the past, even though it's a different process. If you work with people that have been peer assessed, if you work with people that are peer assessors, ask them questions. They can all be very helpful. You see, it looks like one more question has come in.
One more question, just to be sure, we're to go back to 2022 and upload the evidence there. No, you upload the evidence in 2023. That's the place. 2023 professional standards.
Yes. Oh, that's a good question. So the peer assessors will only have access to your 2023 SAT. They will not have access to anything else. So if you do upload to 2022, you will get an email saying, "Where's your evidence? You should have done this months ago." So
another very good question. Are all of the standards reviewed by our assessors or just a select few? Thank you. Okay, so in the regular peer assessment, all of the standards are reviewed. This is a pilot, an evidence review pilot. They will only be reviewing a certain number of your standards, but you still are required to upload evidence for all the standards. So this applies for clinical and non-clinical. When you receive the synopsis, you will see which standards they reviewed. Hope that helps explain that one.
Yep, but these are good questions. Okay, thank you so much, everybody. Again, if you have any further questions, let us know, ask each other, ask some of your colleagues, but wishing everybody the best of luck. Thank you so much for taking part.
Thank you.